An electrocardiogram, often referred to as an EKG or ECG, is the recording of electrical activity of the heart. With each beat of the heart, an electrical impulse travels through the heart. With the use of selectively placed electrodes, the electrical waves can be measured and displayed. This display indicates the overall rhythm of the heart and shows if the electrical activity is normal or slow, fast or irregular. The other piece of information an ECG provides is measurement of the amount of electrical activity passing through the heart. The doctor can assess with this measurement if parts of the heart are overworked or too large. The IQecg system from Midmark is an easy-to-use, non-invasive 12-lead interpretive digital ECG and software solution to help you quickly administer testing to make informed cardiac assessments. This tutorial is intended as an overview of the IQecg and will guide you through the setup, preparation, performing of a test, and editing of results. In this video, the IQecg is being operated with the IQ Manager software. For EHR EMR customers, please contact Midmark Support Services at 1-800-624-8950 option 2 for any additional instruction you may need. To begin, we will review the package contents and setup of the IQecg. The IQecg comes in a carrying case with a quick reference guide, operations manual CD, one package of electrodes, and a package of 10 universal clips. The IQecg device and one 10-lead patient cable. You can now attach the patient cable to the IQecg and then attach the color-coded clips to the color-coded patient cable leads. Before plugging the IQecg into the computer, make sure that the IQ Manager software has been properly installed. Please refer to the operations manual for complete installation instructions. On the computer desktop, double-click on the IQ Manager icon and the opening screen for IQ Manager will appear. To customize the IQ Manager software, click on the Configuration button. Enter your institution name and address and other information in this screen, and then click on the ECG Settings button. At the top of this screen are 4 tabs. Click on each tab to find, enter, and/or change information in that field. When you are finished, click on the OK button, and this will take you to the Configuration Settings box. Click on OK, and you will now be back at the IQ Manager opening screen. Connect the USB or serial end of the IQecg cable into the computer and check that the green LED light is on, indicating that the device has power. To prepare for an ECG test, your patient must be undressed from the waist up. For female patients, ask them to remove their bra and wear an exam gown so that it opens from the front. It is very important that you explain to your patient that all preparation steps, including shaving the hair from the electrode sites, must be done. Proper preparation will assure optimal resistance between the skin and the electrode. Remember the following points when preparing a patient for an ECG. The patient should be relaxed and in a comfortable supine position with the legs and arms supported. Keep the patient warm to avoid shivering and/or muscle tension. This could create noise that may interfere with the ECG tracings. Always shave the electrode area and then clean the area with alcohol. Before applying the electrodes, make sure that the cleaned area is completely dry. Another vital component for an accurate ECG reading is the proper placement of the electrodes. Refer to the quick reference guide for assistance with lead placement. Any deviation from the proper placement, for example, due to a physical deformity, must be noted. You are now ready to place the limb lead electrodes. Right arm. Place the electrode on the right lateral side of the upper arm below the shoulder. Left arm. Place the electrode on the left lateral side of the upper arm below the shoulder. Right leg. Place the electrode with the tab facing up on the inside calf, midway between the knee and ankle. Left leg. Place the electrode with the tab facing up on the inside calf, midway between the knee and ankle. Next is placement of the chest lead electrodes. V1. Place the electrode on the fourth intercostal at the right border of the sternum. V2. Place the electrode on the fourth intercostal at the left border of the sternum. V4. Place the electrode in the fifth intercostal space at the midclavicular line. V3. Place the electrode midway between V2 and V4 on top of the fifth rib. V5. Place the electrode at the horizontal level of V4 at the anterior axillary line. V6. Place the electrode on the horizontal level of V4 and V5 at the mid-axillary line. With the electrodes in place, connect the clips attached to the patient cable to the electrodes as follows. Right arm, white, white lead. Left arm, black, white lead. Right leg, green, white lead. Left leg, red, white lead. V1, red, brown. V2, yellow, brown. V3, green, brown. V4, blue, brown. V5, orange, brown. V6, purple, brown. Remember that the right and left designators on the patient cable are referring to the patient's right and left. Here is a list of items that may cause lead quality problems and should be avoided during the ECG test. Improper or no patient preparation before placing the electrodes. Patient movement or talking during testing. Improper electrode placement. Dried, loose, or expired electrodes. Check the expiration date on the package if you suspect the electrodes may be expired. Patient or clinician touching the electrodes during testing. Patient touching any metal parts of the exam table or bed they are lying on. To perform an ECG test, click on either the Patient List button or New Patient button. In this example, we will be setting up a new patient. In the New Patient screen, enter the complete patient data. The date of birth and gender of the patient are important data points for an ECG test, and this data must be entered correctly. If you have already entered the patient's data into the IQ Manager software on a previous visit, click on the Patient List button and search for the patient by last name or patient ID. When you are ready to perform the ECG test, click on the New Test button. Click on the ECG button and enter the technician's name, physician name, and indication information, and then click on OK. You will see the patient's live ECG scrolling on the screen. Sometimes there are environmental interferences that can cause ECG artifact. A common interference is noise caused by the AC adapter plugged into your laptop. Always make sure the adapter is disconnected from your laptop when conducting an ECG test. The IQecg comes with 3 types of filters to help you get a clean ECG. An AC filter is to help eliminate the AC noise in the room. The drift filter is to help stabilize the ECG baseline so it does not shift up or down. The Myo filter is to help eliminate muscle noise. Please note that the Myo filter should be turned off for pacemaker patients. Click on the Analyze button once to capture the test. The tracing captured will be the same data that you see on your screen. If you need to capture another test for any reason, simply click on the Analyze button again. To exit from the live ECG screen, click on the Review button. The IQecg comes with additional functionality that allows you to monitor the patient's live tracings and capture an ECG as it appears on the screen at the touch of a button. It also includes a range of reviewing and editing tools. The Zoom tool allows you to magnify the tracing by 2 times or 4 times by clicking the 2 times button. Electronic calipers allow you to measure the amplitude and duration of any part of the waveform by clicking on the caliper button. Macro diagnostic statements can be viewed and edited by clicking on the Edit Diagnosis button. To delete an interpretation, highlight the line and click on the Delete button on your computer. Adding to or changing the interpretation can also be performed in the Edit Diagnosis dialog box. Serial comparison allows you to compare up to 4 ECGs for the same patient by clicking on the Serial Comparison button. Once the physician has reviewed and/or edited the ECG, they can sign off on the test by clicking on the drop-down arrow of the Reviewed By box and entering their name. One other helpful feature of the IQecg is the Stat ECG feature. You can hook up a patient and run a Stat ECG right from the IQ Manager main opening screen. Once you complete the test, you can save and/or print the report by clicking on the Analyze button. You will be prompted to enter the patient information when you click on the Report Review button. Help buttons are available in all screens to assist you. Just click on the Help button to access information about the screen you are in.